So we also see a number of patients with food allergies. In fact, we've seen them from various countries and all over the United States. And when we're looking at food allergy, it all starts with identifying the appropriate patient for our treatment. And we can start with a great history, but also with some innovative testing that increases the sensitivity and specificity of getting a better diagnosis for you or your child. So part of the evaluation with food allergy patients includes a combination of things, and we like to do some blood testing and also some skin testing. Now with the blood tests, we're able to do not only traditional blood tests like evaluating what we call serum IgE levels, but we're also able to do a more extensive one called basophil activation tests. Now with skin testing, it's just quick. It's like let's show you real quick, just a sample. We just put a stamp on the arm, just like that. We're able to test 10 things at a time. We can do that on a forearm or on the back, and we have results within about 15 minutes. So if you look here, there's an inner bump that forms, and then there's kind of an out, and we call that the wheal, and then there's an outer area of redness, and we just call that the flare. And if you compare that with normal skin, so if you're allergic to something, you may develop a reaction that looks similar to that, whereas if you're not allergic to it, nothing happens. So when we've identified somebody that has a potentially life-threatening food allergy, we can do a treatment, and it's called oral immunotherapy, or abbreviated OIT. And what this process is where we start off with microscopic amounts of what the patient is allergic to, and then with calculated and a methodical approach, we're able to gradually, slowly increase their dose and exposure. And as we do so, their body develops some immunity and tolerance against the food. So let me show you something. So what we can do is, for instance, we can start off with a certain peanut solution, and that's a dilution of peanut, and it's very dilute. And then we can gradually increase the concentration of peanut protein that's here until we get more and more and more, until we get into actual peanut flour that are in capsules. And with that, we have varying doses of those capsules, and then we can gradually increase that dose until they're actually consuming the foods. And then we start off with the foods in small amounts, and then can continue to build on that. And if the patient wants, they can go until they can eat the food freely and eat whatever they want. And it's really freeing to the patient to not have that burden of the potentially life-threatening reaction that they've been carrying probably most of their life.